Hi there, hope you're having a lovely day so far. Well, there's no doubt that the demands of homeschooling amidst the coronavirus crisis is a major concern for Australian parents, especially if you're a parent working from home. Now, the government jurisdiction in some Australian states are for children to be homeschooled in term 2, with only schools open for vulnerable students and children of essential workers. In all other states, there's an increasing number of parents opting for remote learning to help keep their kids home during the COVID-19 restrictions. Now, supervising children in their schooling whilst being expected to be efficient in your day job has the potential to create a great deal of stress and family conflict. Now, while the sudden disappearance of kindergartens, preschools, primary and secondary schools may be absolutely destabilising for parents, there is actually easy ways to combat this situation. And to help share this homeschooling advice to parents, we're actually joined today by Homeschooling Doctor's Clinical Director, Dr. Ryan Harvey. Now, Dr. Harvey will share his tips on how to maintain a healthy routine for kids whilst juggling homeschooling during the COVID-19 isolation. Thank you so much for your time today, Dr. Harvey. How are you?
Good, thanks. Thanks for having me.
Yeah, well, really, really honoured for your time. Now, these are really tough and difficult times, but parents and students are really sort of up for this challenge. I'd love to know, what are your thoughts on this?
I think most definitely families and their children are up for this challenge. I mean, as a parent myself, keeping your kids educated and also entertained while in a quarantine lockdown, and also managing to potentially work from home yourself can be challenging, but I'm sure it's a challenge that we're all up to. And I thought I would share some recommendations and some tips from a doctor's point of view to make sure that we get the best outcomes throughout this period.
Yeah. Now, as a doctor, really, what's been your experience with patients around sort of the COVID-19 crisis at the moment?
Yeah, in relation to patients, there's a lot of obviously anxiety out there in relation to COVID-19, and this has led lots of families at this point in time to be very reluctant to approach a lot of the healthcare services, which we really need to address, because during this time all the usual illnesses that people will catch or become ill with are still occurring in the community. And we don't want families afraid or anxious to approach healthcare at this point in time, because they could become unwell and have a bad outcome because they've refrained from seeing their doctor or seeing a doctor. So it's one point I'd really like to get across. The doctors are still there. We, Homeschooling Doctor, are still seeing patients, and we're doing it using all the proper protective equipment and the correct hygiene routines and recommendations from government and from our clinical training.
So if families have a child that becomes sick, what's your opinion? What should they do?
So if a family has a child that's sick, they most definitely should approach a healthcare professional and obtain advice. Now, this can be in many forms. This can be from attending your general practitioner in the after hours. It could be seeing a service like Homeschooling Doctors, or it could be approaching a telehealth service. We offer both at Homeschooling Doctors. The worst thing the family could do is not do anything, and their child becomes more unwell, and unfortunately then has to be seen at a later date in a hospital situation, which is not ideal. So when there's first signs of illness and the parent's concerned, then they should be seen in primary healthcare as a first step, and all the necessary precautions are in place to make that as safe as possible at the moment.
In your opinion, why do you think families are avoiding healthcare workers at the moment?
Yeah, so I think there's a perception that that coronavirus is at the hospitals and it's with the doctors, or that's where the patients are. Where in reality there is already fantastic procedures in place to triage and screen patients with potential COVID-19 to other areas of both, hospitals and medical clinics. So patients with other illnesses don't necessarily need to even come in contact with these patients, and all the appropriate procedures are in place to avoid that, because as doctors we're most aware of how our coronavirus is spread, and we do everything to prevent that spread. But we're also very aware that all the usual things that you'll get sick with are still going to occur. You need to be seen so that yours and your family's health is maintained throughout this period.
Mm-hmm. Now, you've mentioned before for parents with children that are being homeschooled and or that are home with the restrictions, that it's really important for families to maintain balance and healthy habits. Can you just tell us a little bit about this thought process and why you think it's so important?
Yeah, I think it's important that we create this routine at home. So it's important to be flexible and adaptive when creating this home routine. And I think it's important that the children themselves become involved in creating the plan for the day, so they're engaged and they're more willing to undertake whatever routine that you create. And it's also important that this reflects, in essence, all the important aspects that are required: the education aspects, the physical exercise aspects, the eating well aspects, all need to continue throughout this time. It's not a time just to pop down in front of Netflix for the next few months. So there needs to be that structured routine that also incorporates that flexibility. So there's some time for learning, there's some time for meals, some time for physical exercise, and it's important. If we create that, then we'll be at our best. We'll be at our best physical health and mental health for the family throughout the period.
Mm-hmm. And what do you see as being the greatest concern for families during this time?
Yeah, so the greatest concern, I think, are those challenges of our health, maintaining our health, and also making sure that our children aren't stalled in they're learning their education and they're not going backwards. So I think a lot of families very much want to make sure that their children's education still progresses throughout this time, make sure that their children maintain good physical health, and obviously avoid illness in this time. And I think balancing all that together, and often in a lot of parents' circumstance, they may also have to work from home, which is an additional challenge that has to be overcome.
Yeah, I was reading an article earlier, and it mentioned that if we don't look after ourselves and our family well during this time, our health can actually, as we come out of this pandemic and this crisis, can actually be worse than what we've actually come in, because we're not physically moving as much, we're possibly eating more and or eating not enough of the healthier foods, and really it's the message is very, very strong that we do need to be looking after our health, mental, physical, during this time. So we do ensure that when we get to the other end of it, that we are going to be healthier and not the flip side of that. What are your thoughts on that?
Yeah, very important. So now there's two main aspects of that. One of them is diet. So the important thing is obviously make sure we're stocking up on plenty of the fruits, vegetables, and those healthy snacks during the day, so you don't give in to the unhealthy temptations all the time. It's vital to make sure we keep up our fluids as well, stay hydrated, so keeping plenty of bottles of water around the home. Physical exercise should be planned into the day as well. So just like at school for your children, there's break periods where they can go out and play. There needs to be break periods where they can get some physical exercise, whether that be in the home, the backyard, or down the park for that period of time, obviously keeping the normal physical distancing measures in place that we're required to do at this time, but there's plenty of options for exercise, and it's a good opportunity for the family to be creative around this and find out what works for them in this time.
Mm-hmm. Now, we published your article titled Advice to Parents Homeschooling Their Kids. Now, for someone who hasn't read the article, can you give us a little bit of an overview what it's about and what inspired you to write it?
Yeah, so I wrote the article because I wanted to give parents a bit of direction in terms of how we're going to manage all these additional aspects throughout this time, being the education of our children, their health, their diet, their exercise, and also the normal hygiene that's required at this time. So I went about writing the article and first putting down how to create a bit of a routine, what are the important things that we need to do in terms of our diet, the important aspects we should put in terms of our physical health, and then a bit about the appropriate hand hygiene techniques and the aspect of, it's very important, good evidence shows that we should wash our hands for 20 seconds at a time, and this is the best way that we can rid ourselves of the germs. And your parents can be involved in that and teach the kids how to do this. And you could come up with a song. There's many of them going around at the moment that last for 20 seconds, and it can be a fun activity that the family can get involved in. And just making sure that we schedule the time to do those hygiene activities as well, which involve cleaning up, washing up after the meals, cleaning all our workplaces, toys, etc., and making sure that alongside with a good flexible routine that we develop for the family and the children, that we also are maintaining really good basic hygiene practices in the home, which will be the best way of staying healthy in this time.
Mm-hmm. And should families be sticking, now this is about homeschooling now, but a question for you, but should families be sticking to a routine when homeschooling? I'd love to know your advice.
Yeah, I think routine's key. Whatever your routine will be what's best for you. Now, it can be flexible and adaptive, i.e. some days it might be a good opportunity to focus on a different aspect of the child's learning, or there may be an opportunity to do a different physical activity. But keeping a routine that works for your children, works for you, is what's key, and making sure that the children are also involved in developing that routine, and they're happy with it. If your children are happy with it, you're happy with it, then it's something you're going to be able to maintain for weeks or maybe months, depending how long we need to do this for. If there's conflict over the routine, then it's going to just be more difficult to maintain that in the home and in the family.
Yeah, I'd love to know your opinion. Do you think that the sense of complete chaos is actually more anxiety provoking than kids actually having a schedule from that perspective?
Most definitely. So I think having no routine, chaos, no direction for what we're going to do from Monday to Friday will become much more difficult to manage over days and weeks, and it'll lack sort of a goal of where you want to get through to with your children, say in terms of education or even physical activity. Developing that routine will allow you to set some goals and set some sort of endpoints of where you and your family and your children want to be, say 2 weeks from now, 4 weeks from now, 2 months from now. The complete chaos and no routine will, I think, increase anxiety and lead to sort of worse mental and physical health outcomes for the family over this period. So creating something that works for your family and that you can move forward through, so your children aren't stalled and they're continuing to develop, I think is very important.
And so do you think it's easier to get buy-in from the kids so they actually know what to expect with all of this then, and then with that to set timelines and to make the guidelines quite clear so they actually get some structure in their mind as to what's actually happening and when?
Mm. Yeah, I think it's important to set those type of timeline structures,
Mm.
so we all know, so we're all on the same page basically throughout the day. I also think, we can be a bit too strict. So sometimes it may be, we move lunch up 10 minutes because that's appropriate for that time of the day. So there has to be some give and take, and obviously sometimes you may see your children are becoming tired, losing energy during this at-home maths class. So maybe the best thing is to go outside for some fresh air at that time. So we have to be a bit adaptive as well in that sense.
And that leads perfectly to my next question. Do you think it's important for kids and parents to be getting some outdoor time as part of their homeschooling?
Yeah, most definitely. I think the worst thing would just be to stay inside for the next term. Getting outside is very important, not only for our physical health, but also our mental health, and being active and having the fresh air. Obviously, the normal health messages like sun safety still exists if we're outside, as it does at the school, wearing sunblock and your hat, and making sure it's not in the hottest times of the day. So we still have to be mindful of that. But being outside, whether it's your backyard or if you live in an apartment, it's the local park, maintaining appropriate physical distancing is very, very important at this time, and it should be a daily activity, in my opinion.
And you mentioned earlier about before about the importance of keeping areas clean and sanitized. So how often should we be sanitizing and cleaning workspaces, toys and devices, really to make sure that the home remains a safe place?
Yeah. So rough recommendations, maybe every 15 minutes or so after an activity. Say if you've used toys, take a few moments just to give them a wipe over. Larger activities that go on for longer, say cooking or whatnot, then we obviously want to clean up after that. But regularly throughout the day is the message. We don't want to leave these surfaces at this time to become very dirty and dusty for days at end, and then just clean once a week. But now is not really the time for that. We know that these bugs live on surfaces, so if these surfaces are cleaned at regular intervals after we've used them, then that'll reduce the risk as much as possible to the family.
Mm-hmm. Well, you've given us some really insightful information during the chat today. How would you summarise, I guess, your key messages out to families at the moment who have kids that are being homeschooled?
Yeah, so the key message is, I think it is a challenge, but I'm sure every family is up to it. You need to develop a routine that works best for you, works best for your family, that maintains both your physical and mental health throughout this period. And if we do these things, then your family will move forward, and your children will move forward in their education and come out the other side healthier and happier as a result.
Mm-hmm. Wonderful. And then overall, that I guess not to avoid any healthcare workers or any healthcare professionals during this time. That if, and as you mentioned before, could you just expand on that point one more time?
Yeah, no, it's important that during this time, if you become unwell, then you seek medical attention. The worst thing you can do is stay at home, become very sick and unwell, and then end up in an emergency situation. So if you become unwell, please seek healthcare. That's a very important message at this point in time.
It's wonderful. So grateful for your time today, Dr. Harvey, and hope to have the opportunity to talk with you again in the not too distant future. Take care. Have a great day.
Great, my pleasure. Bye-bye.
Bye.